Hi, everybody. This is Dr. Eliana Aaron. Today, I want to talk about mental health and the pandemic. So, a lot of people have been struggling with mental health related issues and stresses since the pandemic began. Some people started getting panicky during the first wave, just with the flood of information that was coming in, and it created a state of anxiety for a huge number of people. And actually, a lot of the pharmacies here in the Kupot Cholim were actually reporting that they were running out of sleeping medicine and anxiety medicine because there was a surge in prescriptions, which is understandable because humans are afraid of the unknown, and there was a lot of unknown, and there were a lot of scary reports flying around. We're in a little bit of a different situation with the second wave because we know a lot more, although we still don't know everything. And a lot of things are not as clear cut. And anytime you're in a situation where there's a restriction, you always have the human need to be free and not to want to be restricted to a specific area, like stay home. No one wants to do that. People want to go out. So there's a lot of understandable anxiety that goes around during a pandemic. I think specifically what I want to talk about today is coping with quarantine, because quarantine is something that a lot of people in Israel, hundreds and thousands of people in Israel and millions around the world have experienced. And anyone who's traveled internationally, you know, a lot of people are actually experts in quarantine because they've been through it so many times. So the key to quarantine mental health is a few things that we need to keep in mind. Number one is you have to keep your mind occupied. Vegging, you know, if you're traveling from outside the country in the first day or two, you need to veg because you're jet lagged, completely understandable. But vegging is not a good idea for your mind, and it's not a good idea for your mental health. Keeping yourself occupied, going to Zoom classes, keeping busy, occupying yourself with social activities, speaking to friends, Zooming, FaceTiming with people, talking to your family members is all very important in terms of your overall mental health. So staying connected to people. The other thing a lot of people are doing is that if they're in a quarantine room and there's a door, that they're talking to people through the door. I'm not talking about opening the door, but I'm talking about speaking to actual live human beings through the door. That's particularly useful on Shabbat when religious people don't use electronic devices. Very important to connect with people who are quarantined, whether they're sick or not, so that they have a human voice. I also sometimes see people who have a balcony in their quarantine room, you know, on a second floor or higher, talking to people outside. Now they're very far away from each other, so there's no cause for concern. And of course, the person outside is wearing a mask anyway. But having the little bit of human contact is extremely important for human health and mental health, of course. Getting some fresh air. Now, obviously, it's ideal if you have a quarantine space that has some outdoor enclosed area, like a merpeset or a garden. That would be ideal, as long as you're not, as long as there's a barrier between you and the outside of that space. You can't, if you have a merpeset that's attached to a neighbor's, then you can't go outside. But it is very important to get some fresh air. So if you're stuck inside a room that doesn't have a merpeset, open up the windows, open up the trisim, you know, like I want to see the sun. I want the sun to come in. I want you to sit by the window and get some fresh air. Vitamin D, which you get through sunlight, is very important for corona, first of all, but also very important for your circadian rhythm and your mental health. People who don't have access to fresh air and to the sun actually end up being more depressed than other people. So that's very important. I think it's also very important to understand that there's a media overload right now, and going online and reading about corona can make you crazy. It actually can make you crazy. It can make you so stressed out that you're not functional anymore. So limit the amount of time that you spend a day looking at this. I mean, the reason why we even started a Corona WhatsApp group with a once a day, information is so that you're not people who want to know what's going on, but don't want to be continuously bombarded with information, can once a day go, check what's going on, and then come back into their own world. So that's very important. That's why we started the WhatsApp group to begin with, to give people information, but not to have them emotionally stymied and harangued by the news. And it is quite overwhelming. I think another thing that's a good idea is that if you have hobbies that you're able to bring inside the quarantine room, like knitting, painting, coloring, anything creative, even puzzles, are very good also for your mental health and also for your overall well-being, is to be accomplishing something, doing something, and having some goals. I also want people who are in quarantine to exercise, and that's super important. There are lots of YouTube videos. A friend of mine is using a program called Walking at Home or Walking in Place, and it's actually very intense, and you could choose different amounts of times, but that gives you a good amount of exercise that you could do from your room and at home. Overall, it's not easy to be in quarantine. It's not easy to be sick. It's important to know to be able to access healthcare through telemedicine if you're not feeling well or if your symptoms are getting worse. So know what your resources are. I want to say that during the first wave, we had several students with a history of mental health issues, and those are higher risk students as far as being concerned about how they're going to cope with quarantine. And some of them had very serious histories of depression and severe anxiety and even self-harming behaviors. And what we actually found is that with meditation and davening and being involved in Zoom classes and being occupied, they actually ended up doing surprisingly well. The kids who had no history of mental health issues, sometimes it was harder for them to figure out how to cope with being alone. But surprisingly, in the first wave, when we had students who had histories of mental health issues, we had not a single case of a student who didn't do as well as can be expected during quarantine. They did surprisingly well. All of them had the option to leave the country afterwards, and not a single one did. And a few of them came back for Shana Bet. So that means that, and knowing that they were going back into quarantine for 2 weeks when they came back. So there's a lot of optimism here that it's surprisingly people are coping with it. It's not easy, but people are coping with it and doing well. And we know that this is protecting people from getting sick. I hope this has been helpful, and I hope everyone stays healthy and takes care of themselves. They hydrate, take your vitamin D, and please make sure to take care of your mental health. Take care.